Our next caller, Janet, has a question about healthcare costs being out of control. Janet, you're on the line with Senator Lee.
Hello, Janet.
Yes, Senator Lee. Mine is on health care. We have many on government help with like Medicaid, food stamps, WIC, Baby Your Baby, all these things to help with those with low income. But the middle class needs our help with health care. It's out of control. I have a son and a daughter who are trying to get, they're with small businesses, trying to get health care, and it's going to cost them around $1,500 a month. Now that's out of control.
Janet, I agree with you wholeheartedly. When I first heard your name, I was reminded of the fact that my own mother's name is Janet, and I wondered whether she was calling in. While you're not my mother, you asked a question that she might well have asked, because like so many other women throughout Utah, like so many other mothers and fathers throughout Utah, you're concerned about your children and their welfare, particularly when it comes to health care. What we've seen with the Patient Protection and Affordable Care Act, also known as Obamacare, is that number one, it has never enjoyed the support of a majority of the American people, not since the day it was passed. Number two, it has made health care less affordable and less accessible. It's made it more expensive. Just yesterday I was given a briefing here in the United States Senate about the fact that we're seeing healthcare premiums skyrocket. We're also seeing deductibles on health insurance plans skyrocket. People are buying health insurance that they almost can't afford for the simple reason that the premiums are killing them. And then even after they pay the premiums, the deductibles are increasing so high that they can't use the health insurance that they've just been forced by the law to acquire. And so this law was a wrong step. It was a step strongly in the wrong direction. That's why I believe we need to repeal Obamacare in its entirety, and we need to start over. We need to start over with a series of free market reforms that will reconnect patients who need health care with their doctors and their nurses, so that medical decisions are made by doctors and nurses and patients, and not by government bureaucrats in Washington. We need to empower free market forces so that individuals can negotiate on fair and open terms, possibly in some circumstances across state lines, so that they can arrange for the payment of their own health care services. What we ultimately have to remember is that this is about the acquisition of health care and not necessarily just health insurance. The government, in passing Obamacare, teamed up with some very powerful allies in industry and brought about a law that isn't really about health care. It's about health insurance, not just any health insurance, but that specific type of health insurance that the Obama administration decided it was going to compel every American to purchase. Now, this has made a few people really, really wealthy. It's been very good for a few people in certain industries that have benefited from Obamacare, but it's made everyone else much poorer. And there are a lot of hardworking, poor and middle-class families, like those that you've described in your own extended family, who are struggling just to get by, who are forced, compelled by law, to buy health insurance that they then can't afford to even use because they can't even meet their deductible, even assuming they're able to afford their premiums, which so many Americans cannot. This is why I urge all within the sound of my voice to join me in the cause of calling upon Congress to repeal Obamacare lock, stock, and barrel and replace it once and for all with some free market reforms. What we're after is something that would be better even than the pre-Obamacare status quo. What we had prior to Obamacare isn't perfect. In fact, it wasn't great. It's better than Obamacare, but we can do much better. What we suffered from pre-Obamacare was escalating costs brought about as a result of government's excessive intrusion into the healthcare industry, resulting in the failure of free market forces. If those free market forces are restored and they're allowed to operate, we'll see more robust competition in the healthcare industry, and you'll see prices go down. You look at those aspects of healthcare in which prices have gone down rather than up in recent years. Very often, they are coextensive with those areas in which people tend to pay out of pocket for one reason or another. And a lot of that has to do with the fact that free market forces bring about competition. Competition tends to improve quality while bringing prices down. That's what we need to do in healthcare. And we've got some very good minds here in Washington who are working on ways to reform that and replace Obamacare.